Dr. Vinita Mathew with OAD Orthopaedics. I'm specialized in physical medicine and rehabilitation, also known as physiatry. My special interests are in the treatment of musculoskeletal and spine disorders. I also do interventional pain procedures. And today I'm going to explain to you about lumbar epidural steroid injections. The goal of our treatment is to reduce, relieve, and manage pain, and to improve a patient's quality of life and overall function. This procedure is used to treat acute or chronic low back pain and pain radiating down the leg, also known as sciatica. The common conditions that cause these symptoms are degenerative disc disease, lumbar spinal stenosis, or disc herniation pinching on a nerve. The most important diagnostic tool used are a detailed history and a thorough physical examination. Imaging studies such as plain X-rays, MRIs, CT scans, myelogram, and even a test called EMG test where we test the function of the nerves are utilized. The lumbar epidural steroid injections can also be used as a diagnostic tool. This is used in patients who have severe degenerative disease where multiple nerves are involved. This injection is then used to find which part of the spine is the cause of the pain so that a surgeon can target that level for a more long-term relief. This injection is an outpatient procedure typically done in a surgical center under live X-rays. X-ray guidance is utilized to guide the needle and to confirm the placement of the needle. Patient usually lies on their stomach and their skin is cleaned and anesthetized. Once the skin is anesthetized, a spinal needle is inserted till it reaches the space called the epidural space. Now, epidural space is an important area as it communicates with the nerves and the discs. Medication is then placed into that area so that it can reach these areas. Now, let me explain that in detail using a spine model. So this is a model of the spine. These are the bones and the soft tissue between the bones. This is the intervertebral disc. The nerves come out from the back, from the canal, and supply different groups of the muscles in the buttocks and the legs. This is an example of a disc herniation where the disc is protruded out and touching and irritating the nerve that supplies the leg. So as I explained before, the patient lies on their stomach and the needle is inserted through the back, and it can enter either directly into the epidural space between the bones, or the needle is placed where the nerve exists. So once the needle is placed where the nerve exists, a contrast dye is injected to confirm the position of the needle. I have an example of an image of a patient who had an L5 injection. So as you can see in the image, the contrast dye flows around the nerve into the epidural space. Once the position of the needle is confirmed, medications are placed so that it goes around the nerve and the disc which is irritated. The medications commonly used are numbing medications such as local anesthetic or normal saline, and a steroid such as cortisone. Cortisone is used because it's a strong anti-inflammatory medication which decreases the inflammation and irritation of the nerves and the discs involved. Now, these injections may last anywhere from 2 weeks to several years depending on the patient's age, severity of degeneration, and compression of the nerve.